As I said, there is still a lot of confusion, especially in communities, how the waiver will be implemented, and we're seeing a lot of disruption of delivery of treatment services, especially at the community level. Community delivery of medication, of transport services, community health workers, all of these services are currently still impacted, and we're trying to continue monitoring what's happening on the ground. But there is still a lot of confusion about that waiver, and we're hearing and seeing on the ground that it is slowly being implemented. The waiver should mean that 20 million people living with HIV that depend on U.S. aid for their treatment can continue their medication. That's 20 million out of the 30 million people living with HIV in the world. So it's a huge number of people who depend on that support. And let's remember that there's still 10 million people living with HIV in the world that are not on treatment as yet. In Ethiopia, we have 5,000 public health worker contracts that are funded by U.S. assistance, and all of these in all regions of Ethiopia have been terminated. And 10,000 data clerks, very important in Ethiopia, so that we continue monitoring and ensuring that people are on treatment. So as UNAIDS, we estimate that if PEPFAR wasn't reauthorized between 2025 and 2029 and other resources were not found for the HIV response, there would be a 400% increase in AIDS death. That's 6.3 million people, 6.3 million AIDS-related deaths that will occur in future.